Howdy from Texas. I'm Dr. Teresa Irwin and I am the Vaginacologist. So today I'm going to talk to you about pessaries. What are pessaries? First of all, they are made of silicone and they're devices that can be used for the rest of your life to treat both stress urinary incontinence and prolapse. That can be prolapse of the vagina, where the uterus used to be, the top of the vagina, the bladder, or a rectocele, which is where the rectum is protruding into the vaginal wall. So these, or you can have all of them really. Now, there are specific kinds that are used for incontinence versus prolapse. And you actually need to be fitted in the office in order to get the right size and the right shape for you, specifically for your anatomy. The other thing is who really is a candidate. So, number one, if a woman wants to have a child in the future, and she may not want to do surgery because if she gets pregnant, then that's going to put her at risk for developing incontinence or prolapse. So that would be someone who would be a candidate, and she can wear it during the pregnancy too. So if she's leaking during her pregnancy, and as soon as it's over, if she stops leaking, well, that would be just a temporary period of time that she would need to do that. Another candidate would be someone who just really does not want surgery because they fear it, or they would just rather do conservative measures. Another reason would be someone who's got a lot of medical problems that would not be conducive to prolonged anesthesia. So that would be another indication. Or someone who is delaying surgery for, let's say, getting a workup to be healthy enough to have surgery, or because you don't have time off until the summer or Christmas, things of that nature. So those are going to be the primary women that will undergo a pessary fitting and trial. And we call it a trial because we don't know if it's going to work. Most of the time we get it right on the first fitting, but sometimes it doesn't work. Sometimes it falls out while you have a bowel movement. Or sometimes it's fine in the office, but all of a sudden it's painful at home. So when I say that last part, painful at home, it's very uncommonly going to be painful. I probably can name maybe a handful of patients that have had pain with the right sized pessary. So the main thing is women, I guess, just fear of having this foreign object in their vaginas, but it's kind of like having a tampon in there, or a diaphragm, or a contraceptive ring, or even a hormone therapy ring. So it really should not cause any damage, pain, or worsening conditions. We also give you instructions on what things you should look for that would be of concern, or also try to keep you from getting an infection or any kind of ulcers in the vagina, and I'll explain that shortly. So now I want to go over how you would place a pessary. I'm going to show you a ring pessary. This is the most common one that we end up using because it's the easiest for the patient to manage. So when you insert it, what you do is you first fold it over like a taco. Then you take, in this case, the model, but you're going to take one hand, your left hand, or if you're right hand dominant, and spread your labia with that one while you insert with your other hand. And when you get it past the opening to the vagina, once it's past that opening, it's going to actually pop open inside. And there's no adjustments that you need to do. It just needs to be behind the urethra, which is your P tube. So the opening there, you're going to see when you look in a mirror, make sure that it's not occluding it or obstructing it so that you can't pee. And so it's pretty easy, believe it or not, to insert. And we make sure when you come into the office that you are able to do it. If you're not, we make an alternate plan. That alternate plan would be that you come back to the office and we do it for you. So every 2 to 3 months you come in, we take it out, wash it, just plain soap and water, and reinsert it. Now if you're sexually active though, you're not gonna, and you can't manage it yourself, then this is not something for you. However, you could have your partner take it out. So your partner's welcome to come in and we'll show them how to do it. Okay, to take it out, then what you're going to do, I like to take my index and middle finger and basically grab, place it one finger on the front side, one on the back side of the pessary, and Then you'll bring it out to the opening. Once it's at the opening, you're just gonna do a quarter turn. It's hard to do it with this model, but quarter turn, and then you pull it out. And usually it's not too difficult. Some of the tricks that women will use is that they will push, so as if you're pushing a baby or pushing a bowel movement out, so that you can get it out more easily. Some positions to use that will help you to put it in and take it out as well would be to place your foot on a step or a stool, so that it kind of opens up the vulvar area. Another little trick you can use is, and this was taught to me by a patient, is she actually squats down like the exercise and is able to pull it out that way or put it in. Another area you can put it in and take it out is in the bathroom on the toilet seat, or when you're laying down in the bed. Okay, now let's go over some of the different shapes. So I showed you the ring. I told you that's the most common and probably the easiest one to do. There is also the ring or dish. This is a dish, but there's a ring that comes with this little knob as well, and that's specifically for stress incontinence. So what happens is this knob, when it's inside, it will push or compress the urethra. So now we have the gel horn, and like the name says, it's got a little horn, okay? This is the part that points out toward the vaginal opening, and the rest of this is actually going to be creating a suction effect on the upper part of the vagina. And this is more for types of prolapse that's more severe, so stage 3 to 4. And the reason for that is because it's creating that suction, then it's going to be staying in place more readily and not have the risk of coming out, for example, when you have a bowel movement or doing some kind of activity. Versus the ring, it doesn't have a suction effect, and therefore it's going to have a higher risk of falling out. But we know that as providers, so we'll be picking the appropriate one. Another pessary that also has a similar effect is in a suction effect is the donut. This one's really hard to get in and out, so it's unlikely that you'll be able to manage it at home unless you have someone who'll do it for you. So if you have to come into the office, it's going to be every 2 to 3 months, so we can change it out for you. The cube also is similar, except that you're going to have to come every week for this one, because this one doesn't have any holes where your vaginal secretions can exit. So that's why you have to come in more often for that. But there's cases where that's the only thing that works, and the patient either really, really doesn't want surgery or is not a good surgical candidate. Now, to prevent infection and to prevent ulceration, so that, where the skin starts to tear, or granulation tissue, that's where little areas of tissue builds up that bleeds easily. To prevent those things from happening is we have you place this gel. It's called Trimasan, and this is done twice a week. The purpose, again, to prevent infection and ulceration and granulation tissue. The instructions will tell you to put in a whole plunger, but you don't need to. You just need to fill it halfway, and once you fill it halfway, all you do is spread your labia and insert it in your vagina and squeeze a little bulb part. Now, you don't have to get it all the way in. Just beyond the opening is sufficient. The other thing is you don't have to worry if the pessary's in there. If it's in there, go ahead and squirt it in. It's fine. It's not going to cause you harm. It's doing more benefit than harm. So the reasons that you would have to call us, notify us, or come into the office or go into the emergency room if we're not in the office is if you have bleeding that is heavier. So for example, you might have some spotting upon insertion and removal because of the little bit of trauma, tissue trauma upon insertion, especially with the bigger ones. Or if you have discharge that is a color change such as green or yellow, something that just doesn't look normal or smells bad, as well as a fever. A fever of 100.4 is typically the number that you would use to bring you in. And then lastly, it would be pain. Pain should not be happening with the pessary. As I mentioned earlier, it's like putting in a tampon. I know a tampon's a different shape, but the feeling of it should be like that, where you first notice that it's in there at the beginning, and then you don't even realize it's there because you get off on doing your normal activities. So that is the summary, the explanation on pessaries. and they really are great devices for the right person. I hope that eases your mind, and if you choose it, we'll see you soon.